As Black History Month continues, there's a really important conversation happening around mental health in the Black community, especially for children and teens. And research shows that symptoms are often misunderstood or misdiagnosed. And experts say that stigma and limited access to care continues to play a role. Joining me now to talk about Black girl depression and what families should know is Stella Olize, a licensed professional counselor from the Harris Center for Mental Health and IDD. Thank you for being with us.
Thank you so much for having me.
This
Sophia.
is such an important conversation to continue to have. And let's talk about that. Tell us about specifically Black girl depression and continuing the conversation during Black History Month as well.
Yes, absolutely. So typically, roughly 4% of the American population experience depression. And when we think about depression, we often think about sadness, helplessness, hopelessness, even the lack of desire to do the things that we typically enjoy. But when we look a little bit closely more into our Black girls with depression, it looks very different. Those symptoms present itself as irritability. There's also somatic symptoms such as headaches, fatigue, body aches, even self-criticism. And so when those symptoms come up, they then present themselves as behavioral challenges. So it's definitely important for us to be able to address those and see that these symptoms present very differently in our Black girls.
Do we understand where the disparity comes from?
Yes, because historically we have been told to, pull ourselves up by the bootstraps. Don't share the things that are going on inside the home. This is life. We have to be able to manage the situation, and oftentimes we know that with our young girls, even as kids, they tend to see the behaviors of their parents, and so historically we are told that we shouldn't be able to show signs of frustration or sadness. And if we are feeling those things, then essentially we are weak. And we want to make sure and really bring in that stigma that it's not being weak to talk about what we feel, but actually more of a strength.
Tell us about maybe some signs that specifically young girls, teenagers, kids would experience if they did have depression that caregivers might miss.
Yeah, so one of again, what we mentioned is feelings of hopelessness too. However, they could have lack of sleep, maybe less interest in school and interactions, body aches. And so having that conversation with caregivers, being able to talk to our kids about this is what I'm dealing with. One thing we don't want to say is, what's wrong with you? Why are you feeling this way? We want to have that open conversation, open collaborative conversation about, I noticed that things have changed. Do you want to talk about your feelings? I think that gives more of an open opportunity for children to express and talk more about what they're going through, feeling less vulnerable, and then also understanding that they don't have to deal with these struggles alone.
There's help. There is help. And please tell us where families can turn if they are concerned about their mental health or their child's mental health.
Absolutely. They can definitely reach us at the Harris Center. So you can give us a call at 713-970-7000, or you can go to our website at theharriscenter.org. And I want to also express that our services are available to our children, adolescents, and caregivers across Harris County. We provide services to youth and our families, regardless of the ability to pay or their insurance status.
Oh, that's amazing. Stella Olize with the Harris Center, thank you so much for this incredible conversation.
Thank you so much for having me.